Okay, this video is called Top 10 Neurology Advances for Dr. Brandon Beaber versus Dr. Peter Rogers. Okay, so Brandon Beaber is a neurologist, and this is a well-trained guy. He's a smart guy, and he has lectures on neurology. Okay, I'm a neuroradiologist, and the reason I'm showing this to you is it'll give you an interesting sense of what's really happening in medicine. Okay, so he recently made a video about the top 10 advances in neurology. And the first thing he mentioned was transcatheter coiling of aneurysm. That's like a cardiac cath. You start in the femoral artery. You place a catheter within the arteries up into the brain. And when there's an aneurysm, you can put these little thrombogenic coils, metal coils with little bristles, hair-like bristles on them, that make the aneurysm clot off. And that's a nice treatment because it can avoid needing a surgical treatment of the aneurysm, a craniotomy and a clipping. Okay, so that's good. Embolization of AVMs, arteriovenous malformations. Now, the point, though, is that these are rare things, okay? Yeah, they certainly happen, but they're very rare. Most aneurysms are very tiny and don't need any treatment at all. AVMs are just super rare. Okay, thrombectomy for treatment of acute large vessel occlusion and stroke. It's a rather magnificent thing when a catheter is passed up into the brain and a clot is pulled out, or the catheter is placed directly into the clot and clot dissolvers injected, and it reopens the artery. And sometimes they can catch the patient before the patient's had significant symptoms. Sometimes they can partially, reverse symptoms, and that is a great thing. It's a heroic, wonderful effort. But just for you to have a sense of it, during my fellowship, which wasn't that long ago, during the entire year, there was one successful transcatheter thrombectomy of a stroke at a major university that saw tons of stroke. The reason was the patients hardly ever have an appropriate stroke that gets to the hospital early enough and has everything ready to go, okay? At a lot of universities nowadays, it's probably a little more common, but it's a very, very rare event. On the other hand, every single day I'll see hundreds of strokes. Most of them are very small strokes, little lacunar infarctions, silent strokes, and all that sort of thing, periventricular flare hyperintensity, small strokes. Yes, but almost all of these could be prevented by low-fat, low-sodium vegan diet. Okay, so what I'm trying to say is low-fat, low-sodium vegan diet benefits every single person on the planet. These treatments are very rare. Once in a blue moon, a person can get a dramatic benefit from them, but we're talking about rare stuff. Okay, the next thing he talked about was multiple sclerosis benefiting from disease-modifying drugs like this beta-serone. And he has some extra specialty training and experience in taking care of MS patients. That's very nice. He did not mention the Roy Swank diet in this particular video. In the past, though, I have seen him made a video about the Roy Swank diet, and he has some legitimate criticisms of it. It was done by postcards from a distance without physical exam findings and without MRI to correlate everything because it was back in the day before MRI was available. But, and also the Swank diet to some extent depends on catching the patient early and starting the diet early. That's a topic for another day, but that could potentially help a lot of MS patients as well. I've reviewed the literature of Dr. Swank and was very impressed by it. Improvement in epilepsy drugs. Now that's really there is some evidence that the ketogenic diet in some patients can be helpful. The low-fat vegan diet, I'm not aware of that ever being tried in epilepsy patients. It seems to me like the ketogenic slows the brain down, and maybe that's what you want in these epilepsy patients. So I have not studied that too much, and yeah, it's great that there's improvements in epilepsy drugs. Okay, DBS is deep brain stimulation for Parkinson's disease. Now, end-stage patients with Parkinson's can sometimes really benefit a lot from deep brain stimulation. However, it's nice to try to keep those neurons functional as long as possible without needing surgery. And there are some indications that, low-fat vegan diet will optimize mitochondrial function, and that's potentially helpful, potentially reduces the risk for apoptosis. I certainly would do that if I had Parkinson's disease. And I've made separate lectures about Parkinson's, so that's a topic for another day. But, DBS can be beneficial in the appropriately selected patients that have relatively advanced disease. Okay, TPA for acute stroke. Now that's tissue plasminogen activator, clot dissolver, injected intravenously, for example. You can also put a catheter up into the clot and inject it, but let's say intravenous injection is a very relatively common treatment. It's still very rare to TPA a patient for stroke. Yes, it does happen. But what I'm trying to say is every day, hundreds of strokes. None of those are getting treated with TPA or transcatheter or anything. They've already happened. They're old strokes. And even when they're acute, they're usually little tiny strokes and the patient still comes in late. it's rare to get a patient early in on time and to have a neurointerventionalist, endovascular neurosurgeon available and the room available and everything click just right. That's a rare event. Strokes are super common. Low-fat vegan diet, low-sodium vegan diet prevents almost all of them because the main risk factor for stroke is hypertension and diabetes and atrial fibrillation. All those things are super rare in a low-fat, low-sodium vegan, okay? Talked about the Epley maneuver for BPPV, okay? IV immune globulin, IVIG for GBS, Guillain-Barré syndrome, and myasthenia gravis. Okay, that's all nice, but these are rare things. BPPV is not that rare, but it's still pretty rare. Okay, triptan medications for treatment of migraines. Okay, migraines have a significant, they're more common than I thought they were. And so, it's good to have improving treatments for migraine. Some patients will get relief of their migraines just by going low-fat, low-sodium, vegan, organic only, avoiding MSG and whatnot. I've had some doctors tell me they had migraines that went away once they avoided MSG, for example. He mentioned this nusinersen for treatment of spinal muscular atrophy. Again, a very rare disease. Some enzyme replacement theories for Gaucher's disease. So what I'm saying here is it's great that there's all these improvements in patient care, but they're all pretty rare other than the migraine headaches, relatively rare. And Parkinson's, not that rare, but it's still uncommon, okay? Most of the people watching this, all this stuff was going to be irrelevant to them, all these neurology treatments, except perhaps the migraine stuff. Versus low-fat vegan preventing strokes. That's the most common thing. Like I said, every given day, hundreds and hundreds of strokes I see. Most of them small, most of them silent, most of them old. But there's tons of abnormal maladies in the brains. Okay, so the bottom line is all these things are impressive, good for patient care, but they affect only a very small percent of the population. Versus preventing stroke with a low-fat, low-sodium vegan will treat more patients than all of this other stuff put together times 10. So it kind of shows you where, average person should definitely put their investment on all this stuff. And then if they need other things, yeah, sure, maybe it'll help. So anyways.